Hey everyone, welcome back to episode 2 of our show. Today we have Dr. Markande, who's an orthopedic surgeon with us. Welcome to our show, Doctor.
Hi, thank you so much. Thank you for inviting.
Dr. Mark, I'll be addressing you as Dr. Mark, that's all right.
Yeah, it's sure. It's fine. No issues.
Okay, so Doctor, can you introduce yourself to our audience?
Yes, hi. I'm Dr. Markanday Acharya. I belong to Cuttack, which is a city in Odisha, and I'm currently practicing as an orthopedic surgeon with the government of Odisha at Subdivisional Hospital here in Banki in Cuttack district. Apart from that, I do a part time of YouTube work. I do some videos of my own. I have my own private practice, which is set up in Odisha, Cuttack as well. And in my free time, I love singing or dancing to any of my tunes. I love reading on varied amount of topics. Thank you.
Wow, I mean, usually we have a picture that doctors are quite nerdy and geeky, but how did you manage to build so many habits apart from excelling in academics?
No, you see, it's not about growing in a particular field that makes you different from others. It has to be an organic and overall growth in your own self. Like, for example, if I do not have knowledge about various other things, it makes me less of a individual. I feel like less of a person with whom people would love to have a conversation with. So I read, and apart from that, I see that if you go to any events that you know, or any if you visit any friend's house or something, you would always love to have a good time. And good time is like singing, dancing, and enjoying yourself. I thoroughly enjoy singing, dancing, and doing all these things. So gradually, I have developed all these tastes over time.
So we all are hungry for intellectual talks and you're very curious. Any favorite author or books that you read?
Well, recently I was reading a book called Gods, Guns, and Missionaries. So it's about the situation in which the first missionary movement came into India and how they started the Christian conversion in India, and how the religion of the Indian society that we see today, how it has been affected by their influence after their arrival in India, and how Akbar called them, how it was set up in India for the first time, how you would see that he writes about how there was a massive conversion of Hindus in Tamil Nadu, and then what are the things? How these texts that we read today, like for example Mahabharata, or be it Ramayana, and how these were written, and later on how it got accepted into our society, imbibed into our society, and the religious fanaticism that we see at this point of time, how it evolved over time. It writes about that. So that one is a very good book that I'm reading currently. Apart from that, I'm reading another book. This is called The Interpretation of Dream. It's a very old book, but I wanted to read the actual text, which was written by Sigmund Freud. So I'm reading that. It it does not have much content, but it's good to read. Okay.
That's very interesting. Shows your interest in culture, religion, and so many historic things. And
But Kanchan,
how
as far as I know, you are also a vivid reader, right? What are you reading these days?
uh, recently I started this book called The Silent Patient.
Okay.
I have
Good one.
developed this habit, where I like this genre, thriller, psychology, and
Mm.
I'm trying to get to know how people think more often. So this silent patient is where, a criminal is
Mm.
just, we don't know whether she has committed the crime or not, but is acquitted for that and is just goes silent for so many years. So there's a
Okay.
psychiatrist working, and as we unfold so many things, I can relate how when we have a image outside,
Uh,
like people say, okay, she's like this, and sometimes we are bound to uh, we are bound to act according to our image.
uh.
We put
So it
those
has to be
triggers.
it
Yeah.
has to be ego syntonic to us, right?
Exactly. Sometimes people tag us like you're an introvert, you're an extrovert, and we just
Right.
go by it. So, but then when you actually realize, no, this is myself, I have to be like this. So I'm trying to, read all these things. And
This sounds really amazing. Who's the author, by the way? Don't remember.
I forgot.
But definitely send me the link after this video. Send me this link. I would love to read that.
Yeah,
Uh,
but
any good shows that you're watching right now?
I just finished Delhi Crime season 3. So,
Oh,
oh my
oh,
God,
that's very good.
very
That's very.
heart wrenching, and it
It's
it
very
is
deep,
really,
right?
yeah.
It's very deep. It feels like after watching that series, you feel like you are touched by the things that you saw, and you cannot get rid of it very soon, right?
Definitely, yeah. So,
So,
how did you land up? Like, how did you decide that you had to take orthopedics? It your choice? Was it your like interest from the beginning?
no, it's not like that. See, in life, you are infatuated by certain things. And for men, the infatuation comes from the attitude that you see from the opposite side. Like, I used to see surgeons at a very high level. I don't know. Please don't take it otherwise. As an anesthesiologist, you hate surgeons, but at the same time,
No,
I
no, no.
used
I
to.
don't hate surgeons.
Okay,
I
but it's a common myth that anesthesiologists hate surgeons, right? So that's why I'm telling that I used to love the attitude that surgeons used to carry. And I had seen some of my seniors during my UG residency. They were surgeons, and their attitude was so good. It was so captivating and everything. It was little bit of toxic masculinity, I would say. But at the same time, I used to love that. And
I
later on,
I
what happened
can
is,
relate on that toxic masculinity part.
and as you know, orthopedics is one of the most toxic branches, right? So I was very infatuated with that. Later on, I wanted to become a surgeon, and there were three options that I wanted to take: either general surgery, orthopedics, or gynae. And I
No,
had
everything in cutting.
everything, but nothing with medicines and all. Because I feel, see, more often you see patients. I was in private practice, and I was in government service before joining post graduation. And during that time, what I used to do is I used to see a lot of patients. In government hospital, you would be knowing that the patient load is very high. But when you write some medication to a patient, he or she would come back to you every 7 days, 15 days, like that, with the same complaint. Same thing would be happening. You just have to change the dose. You have to console the patient and send them back. I feel that medicine itself is not a complete treatment on its own. Whereas surgery can give you a treatment, can give you a total treatment, or can remove that entire problem from your life.
But
Right.
having said this, Dr.
But
Mark,
it can also
how
start new problems. Right.
but having said this, how important are these? Because I have seen you people always prescribe calcium or iron tablets or so many things, all these micronutrients. So, with this statement, I just remembered how important are all these nutrients in our day to day life. Like, okay, do you think like as a young adult, if I start taking care of my micro and macronutrients, so I will be less susceptible to developing any joint diseases or anything like that?
Here, I would tell you one small anecdote. You know, this. Have you heard about Mr. Prashant Kishore,
Yes, definitely. Bihar.
the political genius? Okay, I'll tell you this story. What happened is Prashant Kishore was working with the UN somewhere. He was staying outside India, and he had written an article in early 2000s about micro hunger in India. Do you know what is micro hunger? Micro hunger is, see, there was hunger was prevalent in India. They were not getting adequate carbohydrate proteins. That's why we introduced the midday meal scheme for these children. And later on today, we see that there are children those who are not hungry, but at the same time, they're deficient in various micronutrients. Okay, and this micro hunger started amplifying in all the generations, like all the types of all the societal hierarchies. It started amplifying, and you would see that when you go to a higher society, you would find children those who are suffering from vitamin D deficiency because they are not going to the sunlight enough. You would definitely listen to children or women of our age or younger than us. They would be complaining that my hair is falling off. Just
Hmm.
prescribe them a single tablet of Zincovit every day.
Okay.
and you would see a drastic change in their complaints. They won't complain you that there is hair loss. They won't complain you of fatigue. As we all have read that these vitamin B complexes, these vitamins of B, these are very important in ATP pathway. So once you prescribe that small dose of ATP, vitamin B daily, one tablet, once that patient starts taking, in some 5 to 7 days, he would tell you that he is not weak anymore. He's not feeling dizzy. He's not feeling weak. He's not feeling this disinterested. All these things. There are numerous studies which say that vitamin D is somewhat linked to depression. Right. So
Okay.
what you do is you start prescribing vitamin D tablet once weekly
Hmm.
to any patient, and you would see that apart from the antidepressant tablet he is taking, if he starts taking this, the
At
outcome is
least.
relatively better.
Hmm.
The outcome is relatively better. And I'm not a fan of calcium supplements, frankly speaking, because I read few articles which state that this mindless prescribing of calcium, what it does is it leads to hardening of the vessels. So
Okay.
I do not prefer prescribing calcium. But definitely, when you see a woman who is more than 45 years of age and she's complaining of chronic pain, you
Hmm.
start prescribing calcium for that patient for 3 months something, and then you observe that patient, take a like VAS score of that patient, how is your pain, has it
See.
improved or not. You would definitely see there is improvement. So
Hmm.
it's not about prescribing micronutrients. I believe that prescription to the right person at the right time for a shorter duration of time would give a better result than prescribing it blindly.
Yeah.
There are also various studies that say, for example, coenzyme Q tablets, which are available everywhere. You would see that patients, those who are suffering from this weakness, as I was telling, weakness, you prescribe them coenzyme Q, and they would feel very good. They are very happy after that. So it's all about like
But
you can say that it is symptomatic treatment, but at the same
let's
time, it
come
is
to
really
the
working.
cost factor. Now, all this
Right.
which you mentioned, you
Hmm.
think a middle person, like a middle-aged person, can afford all this, or there are natural supplements as well?
No, see, cost, it depends on, again, a few things. You would see that there are people, those who spend that much of money
Hmm.
on unnecessary items which are not
Hmm.
necessary for their day-to-day livelihood. And
Exactly.
again, there are also people, those who use this money for getting those supplements.
Hmm.
Natural sources are available, but the amount of natural sources that you need to consume in order to attain that level, that
Level.
blood level of that drug, in order to work, that is very different. For example,
Okay.
selenium is readily available in pista,
Hmm.
pista badam. So
Okay.
once you start taking pista and this almond, these things you have to take some 4 or 5. Imagine just if you check the cost of pista and almond, and if you
Exactly.
compare it with a tablet of Zincovit,
Tablet.
it is cheaper, right? So like that, I see it in this terms. And one of my teacher had once told me. He told me that a patient, you should not worry about the money always, like
Hmm.
how much it is going to cost the patient. Then you might do injustice to the patient by under prescribing him.
Okay.
Right. Over prescription is bad, but at the same time, under prescription
Under
is bad.
prescription is also bad.
Right. He also told me one more thing, that you should not prescribe more than 4 or 5 drugs to a patient, because he has to remember and he has to eat. So it should
Okay.
not be more than 4 to 5 drugs, but it should consist of everything.
Hmm.
Right.
Given this, Dr. Mark, is there any myth that the population is believing blindly that you want to just bust it? Like, is there anything which everyone is just following without any evidence?
There are so many things. See, India is a land of herds. Okay. So we are like sheep herds. They would see something on the TV, and or they would see something on the YouTube, and they would immediately start following that. So I feel uh, whatever you are following, you can do absolutely whatever you want, but at the
Hmm.
same time, you need to be very cautious about the things you're doing. For example, there was this trend, like some 4 or 5 years back, this trend started that if you're not smoking cigarette, you can start vaping. And there are studies which prove that vaping itself is bad. Even it is worse than smoking. So all these things I see in youngsters, it has to be seen in a very different point of view. Like they should have a little bit of study
Mm.
done on the topics that they are going to they're delving into, right?
Mm. So, you did 5.5 years of MBBS, 3 years of gruesome MD, sorry, MS,
MS.
and then was there any one case which challenged you emotionally and physically, where you felt very helpless, guilty, and all those mix of emotions? Something would have been there.
One case we had during our post graduation, we had one case. That patient was a some uh, 38, 39-year-old man. He was a like daily boozer. He would booze around 1 liter every day,
Oh
like
my
that.
God.
And he did not come from a very affluent family.
Okay.
And what happened is these four friends, they were driving uphill, and his foot was on the what is that called, dashboard of the car, and somehow they fell. Means somehow they had to put a brake, and they some accident happened, and he had got a fractured neck of femur. Since
Okay.
it's a young age, we did surgery,
Hmm.
and it got infected.
Oh.
Again, we had to do surgery. Then it got infected, and it almost took around 1.5 years for that patient to get recovered. His
Oh.
entire hip, his entire leg, and everything had scars over it, and all those scars had little bit of infection,
Was
little
I
bit of
there for
something.
this case?
Yes, you were there. You were there. You were there, and as far as I remember, I would have pleaded you some 4 5 times to get a PAE done for that patient. Wait. Before going there, I just want to know about this. Why do anesthesia means what happiness do you get out of making the by making surgeons plead you to give a case? What pleasure do you get?
No.
It is satisfying.
See.
Uh,
There, I don't know. There is this outlook about anesthetists that we enjoy, we get this pleasure by canceling the case and just going and sitting and playing our game. But no, that's not the scenario.
you cancel the case and you smile over the cell phone and say, "See, we are canceling the case.
No.
We can't do anything. Our staff is saying that you cannot take this case."
Yeah.
Like this, you would say.
Also, during residency, there is hierarchy. So we are
Okay.
not exactly at the point where we can take decisions. So we just
If we
puppet.
ask your professor also, he will also tell the same thing. Okay, I have hierarchy, I have rules, I have protocols, and all those things. But you
But
won't give the case.
now that we are not residents anymore, if I happen to do freelancing, which I haven't started yet, I'm just doing a full time job. So if I happen to do, so I will see the investigation. I'll ask for the basic investigations. So since that was a college and many things were free, and plus those are all above 50, so you had to check for their heart status as well, heart functions. So we had to get an echo and ECG, which was undeniable.
That is all like you're telling tales. See, I would tell you one thing. I feel that since I'm doing freelancing, I'm seeing that if I post a case, very often I would get it sanctioned. Like the anesthesiologist would immediately come, he would
Yeah.
give happily, and we will get it done.
Here the
And
scenario is different.
exactly
Yes.
that same case, if I would have posted during my UG days, then what would happen is the anesthesiologist, Dr. Kanchan, would call me up and would tell that no, man, this is not done, that is not done. This, you have to get it done. No, this patient is so sick. You have not checked this, you have not checked that.
Okay,
These
then
things
let's
he would
ask.
say.
Okay, then let's ask. Let's put it this way. If you had to change how trauma care works in India, just give the complete scenario, what would you change?
Okay. I see trauma care in two parts,
Hmm.
like before hospital and after hospital.
Okay.
So, what we are lagging in is before hospital treatment. At the
Hmm.
site of trauma, you won't have people, those who
Hmm.
are trained to take care of the trauma
The
cases.
paramedics, basically,
Paramedics.
who are not
Actual
trained.
paramedic staffs, they are not trained,
Huh.
or if at all, I don't know if they are getting trained or not. But most of them, I don't feel that they are trained. They shift the patient in whatever form he or she is, and by the time patient reaches, no, you could have stabilized a limb, you could have stabilized the patient, you could have started a fluid to that patient. If you see there is heavy blood loss, you could have checked the vitals of the patient. All these things could have been done at that site,
Hmm.
which he has to get after reaching a hospital, and you do not know the ETA of that journey that he is going to take from the site to the
Plus,
hospital
I
first.
have seen that so many people, example, cervical fracture, or spine fracture, people don't know how to shift the patient
Right,
very
right,
carefully.
right.
And
Absolutely.
sometimes we can lose the patient in just shifting.
During
So I
that
think
time, right?
education and people's awareness should be more given importance to.
Definitely, definitely, it has to be done. This is to be done in the pre-hospital phase. And second thing is that golden hour rule that we talk about. The golden
Exactly.
hour. I
Yes.
don't see patients coming to the hospital and during that golden hour, or if at all they are coming, they are getting operated during that golden hour period. Usually, they don't get. We don't get to do all these things. Second, there is a very big queue in our diagnostic centers, and getting those diagnostic tests done and getting those reports parameters ready and preparing the case for the OT, it takes a tremendous amount of effort and time. So most often what happens is that we lose that much of time, and sometimes we lose the patient as well too. And third thing that I feel, I personally someday if I build my hospital, I would love to start is 10 minutes rule. Any patient
Oh,
walks into the hospital, has to be diagnosed, has to be evaluated. His complaints would be written, his vitals would be checked, his parameters would be sent within the first
very
10
good.
minutes of walking into the hospital. If
Very
I
good.
can do that, what would happen is it would give me adequate time to analyze the patient. And the moment the surgeon walks in or the doctor sees that patient, then what would happen is I know the basic parameters of the patient. I can take care of that patient better, right? If you see, no, like if you go to any of our hospitals, you must have seen all these
Definitely.
things. Like a CBC would not take much time. It takes very
Exactly.
less time to get a CBC
But
report.
we have
You
literally had time lag. We have to send
right?
people to get
Why?
those
Why
reports.
at all? Why at all?
Ex-
I feel very perturbed if I see patients carrying those blood samples going to this place to
Is it
get a
because
bill and to
lack
report.
in labor? Like, is it because of that, or is it because people are not aware of what the job is?
I have this other opinion. I feel everything can be done. It
Hmm.
is about the intention. If that institution wants to, they
Hmm.
can do it. Like anywhere, whatever you do, you don't need a centralized billing counter. You can get a billing done there itself. In private
Exactly.
hospitals, I'm telling you, can get a billing done there itself. Why the patient has to go to a separate place, get a billing done, and all those things? You can take all these things and get it done at each site. I would give a very beautiful example of this. What I felt is, I went to a marriage recently,
Hmm.
a marriage party, and we were having a food. So, usually, what happens is you go to a marriage party, you get plates from one place, plates and spoons from one place, and start collecting items from the different counters in a banquet, right? I'm telling about that.
Yeah.
But I went to a marriage party, and there what happened is there were plates at each counter, and there were spoons at each counter. So
Oh,
if I don't want anything, I did not go and get one plate from the central counter, and I have to come and ask
so it's
them for food.
like divided to each.
I go there, I get a plate, I pick up plate and start eating whatever I want.
So this
Similarly,
shows
I
our
want to
resources should be more.
right. This resources should be more, and everything should be integrated under a common system. Like we are having hospices system running in various hospitals. There are so many apps and websites and all those things which are available. And if we can make proper use of all these things, no, we can get all these data very easily. and there won't be any problem. Like the hassle that we have to go through right now. Right.
Definitely.
What else do you think? Like anything else do you want to add to this?
I agree on this point. And second thing is, uh, I have seen that one good thing recently where I started working, that patient does not have to carry any documents.
Right. This
The
is
patient is just given a card with the
that's
number,
it.
and wherever she goes, suppose you give you have to take a neurology clearance or dermatology clearance. When she visits neuro OPD, they just log in and they update nil intervention from our side, so you can take her up for surgery. So I felt that was really good, where the patient does not have to carry so many documents and hassle free, and anytime you take out her documents, you take out her file on the whatever app that is, so you just get a complete picture what this patient was going through in the past, a complete past history, and you can definitely decide within minutes rather than asking her when you have a language barrier and everything. So
This is very good. This is very innovative. And second thing is, this would the only issue here is you might need a bigger workforce
yeah,
to
yes.
take care of all these things, because you cannot you whatever you do, you cannot type in everything, sit and type. You need a data entry operators for that. But this is a very good idea, definitely. But don't you think that currently our hospitals, like if you see any government hospital, then
Hmm.
it is filled with patients and all.
Hmm.
And if you see private hospitals, these are also getting filled
Hmm.
because of the insurance schemes and which
Yeah.
are available. Do you think that there would be a time in which we would have little bit of patient means we would reduce the patient flow into an hospital so as to provide better care to them? Do you think we would
So
reach to a certain
I think
point?
now everything is dealt online. People opt to go for online consultations. I think many of the things, like they can, if suppose I just got my blood test done and all these investigations, instead of visiting a doctor, taking all the hassle and everything, they can just book an appointment and
Sorry.
just get it verified. And if there happens to be a problem, then they can visit. I think all this will slowly creep in, and it has already creeped in. Many of my family members don't attend unless there's a surgical intervention or any procedure or anything.
No, your family members don't go to a hospital because they got Kanchan on call, and they would call you up and ask that, no, ma, this has happened to me. You tell me what to do.
The
That's why.
problem is, you know, everyone understands the surgical branches. The people still have problem understanding what is anesthesia. They still feel that
This is very
I am a
not people,
person.
even MBBS students, they don't understand this.
Exactly. Everyone still thinks I'm a doctor, only puts them to sleep and just gets them back to life. But they don't understand the amount of stress we take if the surgery has to go smooth, and how we
No,
attend to
you
good
have
news
you have
or
a very
ICU.
valuable area of work. Like
Hmm.
you can work in an ICU, you can work in a trauma care center, you can work as an anesthesiologist. There's so many things that you can do. But if you
Given all
see
these
as an
apps and
orthopedic surgeon, and if you see him reading an ECG, then you would pray that he should not treat you, right? So, but
you
an
know,
anesthesiologist can definitely do that.
given all these apps and all, what's your take on how this AI and everything will take over orthopedics in the near
Right.
future?
But you were telling this, no? I was thinking about it because AI is something that has become a part of our daily life.
Yeah.
I don't remember that I would have Googled something recently. I'm using Perplexity. I
Hmm.
would type it in, and Perplexity would give a better answer than Google. It can send me to that particular link which I need to click and I need to go. If I need some articles that I want to read about before a surgery, before a case, and anything, then that can also be done using AI. Pre-op plannings and all that is also being done with AI using all these technologies which are available. But I feel that there is little bit of time. It needs little more incubation period to come into the limelight. See, if you are going into this topic academically, like what AI can do in orthopedics or in any department per se, then
Hmm.
there is no end to it. the AI can assist in everything that is there. But at this point of time,
I
it needs little bit
recently
of
read an
information.
article
Right.
where you're using AI and technology to design the implant or see the measure. I might not know the exact
No, no,
technicalities,
yes, yes.
but
I'll
I
tell you.
went through this article. So
Uh,
where the implant is used, like how it is designed and everything, they're using the some AI tools. Might
huh.
be.
No, no. In pre-op planning, what we do is for an implant placement or implantation and everything, whatever the procedure is, it needs little bit of pre-op planning. And you cannot actually tell the size of the implant that you are going to get, that you might be needing during that procedure. It can be somewhat close, it can be a ballpark, but you cannot tell exactly. But
Exactly.
using AI, what would it do is it can assess the sizes of the implants. It can design particular implants for that particular patient. For example, if you see the implants that we currently use, no, there are very less implants which are according to the Indian body types or Indian
Why
skeletal
so?
design. I feel R&D is very poor in India.
Okay.
R&D is extremely poor in India, so it's not that commonly available. But with the advent of AI, I hope that in recent future, what would happen is we can have personalized implants for ourselves. We can 3D print those implants at the same time, and we can get those surgeries done. I feel there is a lot of opportunity in AI, and people say that AI is bad. AI would take away jobs. It would definitely do that.
But
I
it
read
cannot
this,
take away our jobs.
but it needs to take away our fights. It should at least tell, no, you can give
I
this
mean,
patient
max to max, you
anesthesia.
can do robotic assisted surgeries, but you are still required there
See,
to.
robotic assisted surgery, it's just like a jargon, right? It
Hmm.
takes more time to do that surgery because you have to set up that robot, and with little bit of movement that needs recalibration,
Hmm.
and everything is done by the surgeon himself. The
Hmm.
robot tells you where to cut, how much to cut, but everything else is done by the surgeon. So robotic assisted surgery has not come in totally. And with the advent of AI, what would happen is AI can analyze these things faster, and it can assist the surgeon. I would tell you this story. I read it somewhere. It was written that if you see a movie which was shot 10 to 15 years back, and if there was an aerial shot which was to be taken, then they
Hmm.
needed a helicopter. A
Hmm.
helicopter was driven by a pilot, a
Hmm.
cameraman with a camera over it, holding and shooting that, and the actors would be acting. Now, if you want to do it, you just need a small, what is that, drone. You would
Drone.
need a small drone camera. It would fly off, it would get that same shot, and three people lost their job because of this. Okay, you
So
need to upgrade your skills in order to become that good, so that you are this recession proof, you are this technology proof, and all these things. But there would
also,
definitely
I
be.
am very curious, Dr. Markandeya, what is the trends of the replacement surgeries over the years? How have you improved in these knee replacement, replacement? Has the trend increased or decreased? Has the need for these replacement surgeries decreased or increased?
No, see, um, replacement surgeries are expensive surgeries to be done. Okay.
Okay.
With the advent of these insurance scheme, what has happened is it has given people that opportunity to go for these surgeries. You would see that most of the surgeries which is happening at this point of time, no, it's because of the insurance schemes that these people got. Uh, if you go through the websites, you would see that Pradhan Mantri Ayushman Yojana. With that, many people would have got their knee replacements done, or in our state we have Gopavandhu Jana Arogya Yojana.
In
Using that
Odisha, you
also,
have all these.
right, in Odisha, we have. And there are people, those who are getting it done. Only this middle strata of people, those who do not have any kind of insurance, or they cannot afford this at that slab of people, they are not getting it done that often. But if you see, there are people from all socioeconomic hierarchies, those who are getting these surgeries done. This
Hmm.
being said, there are also cases where you see that people prematurely want to get these surgeries done because they cannot tolerate their knee pain.
Pain.
I have seen these cases where I would see patients, they are very impatient patient with the treatment. Like if you ask the patient to get a physiotherapy done for 3 months, it is a troublesome idea for them. They would not get it done. They would have very poor compliance to these things, and ultimately they would come back with that same complaint and they would ask
For
for a surgery.
surgery. Okay. So the sports medicine, physiotherapy, and orthopedic surgery, what is the role like? Do they run hand in hand or are they invading your
See,
career?
sports medicine per se, no, it is different from the sports medicine that we practice in orthopedics. Sports medicine is more of kind of a physiology and physiotherapy kind of thing,
Okay.
which is being taught. It is a totally separate branch. But
It's
at
a
the same time,
non-surgical thing?
it's a non-surgical thing altogether. But
Okay.
we have this small part of sports medicine in orthopedics, which deals with the cases of sports-based injury. For example, you have a rotator cuff tear, you have an ACL tear, and if you're seeing around 50 patients a day, you would definitely find around 10 patients those who would be having these problems. There are so many cases of TFCC injury. You
Yeah.
would see so many cases of ACL tears,
Hmm.
instabilities of knee, ankle instabilities, all these things you would see. And because of that, what has happened is it is a very growing branch. And second thing, since it is a minimally invasive operation, so people can get it done. Again, money comes into play here because if you can afford that, then only you would go for those surgeries. If not, you won't. Right.
Hmm. So anything you would like to tell to all the budding orthopedic surgeons who are still thinking should they take up this branch or not?
No, they should definitely take up this branch. I am against anti-competition. I love people. If they come into this field, what would happen is eventually people would start upgrading themselves. If I
I
have
love
competition,
how
then only I would
secure and
upgrade.
confident you are.
No, you should be. No, you should be. You should be confident with your craft. So I want more people to join into my department, my field, so that the competition grows, and this would also give us a chance to have more research in these areas, and thereby we can do better for the patients as well.
I mean, as far as I know you, you also had this interest in politics. Anytime soon, you're trying to step out or step
Huh.
in.
See, I have a little bit of interest in politics, and I would love to join politics someday, mainstream politics. But at the same time, uh, I believe that if you are not good in your craft, then people will never respect you. You have to be the best in your work. Then only people will love to listen to you. Then only people will respect you, and all those things.
You don't believe
Um,
in having multiple,
right.
skills,
See,
but which are
you do
mediocre. But
whatever you want.
excel one
You
thing
can do whatever you
perfectly.
want. No, I feel you can do whatever you want, but at the same time, you have to be good in your craft.
Hmm.
Okay, you have to be the best in your craft. Then you can switch over to something else. So
Yeah.
I would definitely want to become the best orthopedic surgeon. Then I would love to take a swing at this.
I wish you all the very best. So this is it.
And I hope that we meet soon to discuss
Definitely.
more about this of the camera.
I wish I
Definitely.
can be anesthetist to your case sometime soon.
But I hope that you give it
I won't cancel your case.
without having me to plead to you.
Yes.
Okay.
Thank you
So, yeah.
so much for
Thank you so
taking
much.
out some time from your busy schedule, Dr. Markandeya. Thank you.
Thank you. It was lovely talking to you, and I hope that all your listeners grow over time and you become the diva that you always were.
Thank you. Thank you so much.
Thank you. Thank you. Have a nice day. Goodbye.